People, in this video, let us look at molluscum contagiosum. As the name suggests, contagious, right? Contagiosum. So here what happens, basically this is a skin disorder, dermatosis. It is a skin disorder and it is infectious, contagious, infectious dermatosis it is. Okay? It is a common, but it is self-limiting, which is good. Contagious lesion which is caused by what? A pox virus, which is a DNA virus. So it is DNA virus, you should know. Fine, it is caused by pox virus. These are the keywords they'll be looking for. It's caused by pox virus, which is a DNA virus. Okay. It's caused by a pox virus, which is a DNA virus. It is more common in children and young adults. That's why probably a photo of a child here. Next point. Infection is acquired by direct contact. By direct contact, people can get this. Children and young adults are affected more. Clinically, the lesions are often multiple discrete waxy. I think this is more about the lesions. Let's look at it in the next video, next slide. So let's look at the lesions here. So here they are explaining the lesions, they are multiple, you can see here multiple, discrete, each of them separate, waxy papules, waxy and their papules, okay, multiple, discrete, waxy papules. They are about 5 millimeter in diameter. Okay, they are more common on the face and trunk. If they are pressed, there can be paste-like material. Okay, this is what the textbook says. Internet gives some photo, etc., where they are showing some dimple in the center. They are saying it is painless, but this is information from the internet. Textbook says only what is written here. Multiple discrete waxy papules, 5 millimeter in diameter. Face and trunk are affected more. And if they are pressed, if they are fully developed and if they are pressed, there can be paste-like material which can be expressed. Histologically. So what was all this about? This is a viral infection, correct? This is a dermatosis or a skin disorder caused by the pox virus, which is a DNA virus. Now let us look at the histology. Of molluscum contagiosum. So the lesions consist of sharply circumscribed cup-like epidermal lesions growing down into the dermis. An epidermal lesion, okay, which is growing down into the dermis. Is this clear, guys? An epidermal lesion growing down into the dermis. Please look at this photo from Harsh Mohan textbook. Molluscum contagiosum. The epidermal layers show numerous molluscum bodies that are which are intracytoplasmic inclusions. So there will be growth, epidermal growth into the dermis. Epidermal lesions which are growing down into the dermis. And here you can see the intracytoplasmic inclusions, which are nothing but the molluscum bodies. Proliferating epidermal cells contain the pathognomic intracytoplasmic eosinophilic inclusion bodies called molluscum bodies. These bodies contain numerous viral particles. So what do molluscum bodies contain, guys? They contain viral particles. Okay. So what are the keywords here? epidermal lesions growing down into the dermis, intracytoplasmic eosinophilic inclusions called the molluscum bodies, which actually contain the viral particles. Okay? So what causes molluscum contagiosum? Virus, pox virus. What causes xeroderma pigmentation? Inherited disorder it is. So just a recap. So molluscum contagiosum is infectious dermatosis. Let's revise. Common among children. It spreads by direct contact. So it is always good if you can avoid direct contact with people who have this kind of papules. This is gross. The lesions are multiple discrete waxy papules 5 mm in diameter, seen frequently on face and trunk. And a fully developed lesion, if pressed, can release a paste-like material. Histology, epidermal lesions growing into the dermis, intracytoplasmic eosinophilic inclusions which are called as molluscum bodies, which are actually containing viral particles. That's all for now. See you. Bye.